Right, and there are worries that it could already be here. We're seeing cases going up, in the metro cities. The Delhi Chief Minister has announced that they're going to genomic sequence all the positive cases to figure out whether it's indeed here in the community. Dr. Anurag Mehrotra, this has led to a clamor for booster doses of vaccines because even though we have this situation where, we still have not had a majority of our population vaccinated, but at the same time, there's waning immunity. We know there's reinfection with Omicron and there's wastage of vaccines in private hospitals.
That's right. In my opinion, I'm saying for long, we must go for the booster dose, at least for the persons who are going to be in the first line of defense, like doctors, healthcare providers, and administration people. And there is no harm in giving that. There are many studies which support the booster dose, and it is a regular and norm in many of the countries. In India, I suppose because large number of population still not have got second dose, and it is still unvaccinated. So government is taking time to decide whether should we go for the third dose. It may be look like a luxury and favoring someone at the expense of other. Maybe that's the reason. But scientifically, there is no reason to deny that.
All right. And what about, vaccines for children? That's another issue we were speaking about a lot a few months ago. And then suddenly, there's no word on it yet. And this is, again, something that parents are also talking about. And we're seeing in the UK as well as, in the US, cases are spreading among children especially. And, they're carrying it.
Sure. If we don't vaccinate the children, we leave a quite large number of reservoir for the virus to be there.
That's right.
The more the person we have who are vulnerable to infection, we leave them unvaccinated, this is going to the prolongation of the pandemic. So children require that, and there are, again, in many countries it has been recommended. I suppose there are trials going on in India in 5 vaccines for this. And we should have that at earliest. And the thing you were saying earlier, are we going to have third wave or not? I think we are on the cusp of third wave. When there's potential of developing third wave, we must prepare like that only. We have seen the second wave, how fast it develops. So when it starts happening, I suppose it has started happening. And we must take every step to counter that.
No, that's right. In fact, I was asking whether the third wave was going to be in February, and Dr. Shashank Joshi feels that we're going to start seeing it, mid-Jan, the case.